Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today we're at the beautiful Biltmore. We're celebrating our 7th annual Fashionably Red Heart Disease Awareness Lunch. Honor and privilege of having Dr. Joseph Lamelas. He's a pioneer. He's one of the world's most recognized cardiac surgeons, and he currently serves as Chief Cardiac Surgeon for UHealth, University of Miami Health Systems, and we are so proud to have you here with us today. He's going to serve in the panel. And Dr. Lamelas, welcome. And just tell me a little bit about your background, how you started, because I know you have a very interesting story.
Thank you. No, it's a pleasure to be here, and this is actually my second year here, and it's always an honor, and I always meet a lot of new friends, and it's really very special for me as well. So I was actually going to talk about my path to where I'm at today as a keynote speaker. But I was born in Cuba, very proud to be Cuban, very proud to be Latin. That's in 1960. My family and myself came to the United States in early 1963 on a Red Cross boat and started from scratch like many other Cubans did, and we've always been taught the value of education. So that's one of the reasons that I wanted to pursue higher education and became a physician. And while doing my training, I became very interested in cardiac surgery, and it's a very dynamic specialty, constantly changing, constantly advancing. And I've been in practice for 31 years now, and this is my second year at University of Miami, being the chief of the Division of Cardiac Surgery, as well as professor of surgery at the Miller School of Medicine.
Dr. Lamelas, may I ask you, I've read that you have performed over 16,000 heart surgeries.
Actually, more than 17,000 now, and at University of Miami, over 1,000. So it's very.
It's a very impressive record.
Thank you.
And I know that you do minimally invasive surgeries, and there's something that you invented. It's called the Miami
method. Yeah.
Tell us about the Miami method.
Right. So I've done over 7,000 minimally invasive operations, and I began that journey in 2003 when I became interested in doing something more special for my patients, an operation that was less traumatic and in turn provided multiple benefits, which included a quicker recovery and less transfusions. I mean, it's just overall the least traumatic operation we have in cardiac surgery, and I've applied it to single valves, double valves, triple valves, replacing the aorta, congenital defects, removal of tumors in the heart. So I've applied it to many different pathologies in the heart, and it's made an incredible difference to my patients.
And what is a typical day in the life of Dr. Joseph Lamelas? What time do you wake up? How many surgeries do you perform? Do you see patients? How are you able to balance your life, and at the same time I see you here, that's why you're a surgeon and so famous. He's so calm and so relaxed, and I know for a fact how good you are. You operated on a cousin of mine, and you saved his life about a year ago. But tell me, what is a typical day in the life of Dr. Joseph Lamelas?
Well, there's two different eras, one pre-COVID and one post-COVID.
Exactly.
So we're actually getting back up to speed, because I was receiving patients from around the world prior to COVID, and now things have changed, so things are a little bit different. But usually get up at 5 o'clock in the morning, I exercise for 30 minutes, and then go to the hospital, because if I don't do it in the morning, it's never going to happen. I know when my day begins, I just never know when it ends. So, and then I do rounds every single day on all of my patients. I think that's a very important quality to have as a doctor, especially as a surgeon, because you could do a great job in the operating room, but if you don't take care of your patients, you could obviously have problems. So,
and have you seen patients that are delaying their visit to you because of COVID, and then in the end you're seeing that they're worse, right?
Yeah, well, actually we have seen that. There are many patients that want to wait. They've waited months, and some have come in with a heart attack, some have come in heart failure, and others have died at home. So it's really sad to see that, and patients need to understand that the hospital is probably the safest environment that one could be at today. Absolutely. I'd rather be in the hospital, because everybody wears masks and shields, and they take a lot of care to take care of themselves as well as the patients.
Well, Doctor, this has been great having you on a Business Minute with Lily Lopez. Thank you so much, UHealth, for being the presenting sponsor of this annual event and for the continued support. And it is an honor, like I said when I started the show, and a privilege to have you here. And we have over 130 people. Usually this is a 200 people event, that you know. as
Yes.
you were here before and last year, but this year because of COVID, plus we're taking a lot of precautions, and you can see everybody's very social distance, and we have the plexiglass for the doctors to protect them, and we have had 5 live events and no one has gotten sick. So we are taking care of our members
That's
very
fantastic.
much, and I always like to emphasize that in our show so that people know the importance of being safe, taking care of yourself, taking care of your family, your friends, but at the same time, let's not stop the economy.
Exactly.
And let's work hard. So thank you so much,
Thank
Dr.
you.
Lamelas, for being in a Business Minute with Lily Lopez. Thank you all.